Appreciate you joining in earlier and maybe having a rejoin. I'll give everyone a few minutes to rejoin if they can do that. Really appreciate each of you joining in tonight and for your patience. Apologize for the technical difficulties. And by technical difficulties, I mean I forgot my thumb drive to take home to put into our computer. So I made a quick drive back to work, and sorry for the delay in getting going. I do appreciate your patience, and I'm excited to get this going tonight. We'll give another minute for those who need to join back in. It's been great to already look through the panel, the attendees, see a lot of familiar faces and names here. So thank you for those who are joining in and taking time out of your busy schedule so we can talk more about dry eyes. We feel like this is an important part of it in our clinic. We feel like important education is an important part of dry eye evaluation and management. And it's nice to maybe slow down and take a little bit longer to talk about the different clues that could affect our care, the diagnosis and the management. So thank you for joining in tonight. We look forward to having some interactive discussion as well as some questions at the end here. So welcome to Dry Eye Detectives. Again, thank you for your patience and for joining back in. Tonight we'll talk about clues for better diagnosis and treatment. And as part of the Center for Sight and Dry Eye team, and actually tonight will be called a squad. So that's a group of detectives as we try to look for different clues that might help you and I with their dry eye care. And this is all in support of Dry Eye Awareness Month. So we're trying to increase awareness for this challenging, chronic, multifactorial condition. Let me introduce some of the members of the squad here. I was able to use AI to take our pictures and put us into investigative detective mode here. So this is Dr. Ackerman. She's our new resident who just joined us just a few weeks ago. She's joining on us in on the webinar as well, so we're excited to have her with us. Already doing a great job. I look forward to having you meet her if you haven't done so. And then Dr. Befrus is Detective Pose. Dr. Brar, I know many of you know Dr. Brar. I'm glad that she's in with us as well. And then we have really great staff support, team support with Leslie. And then here's myself. I do feel like AI made me look a little bit younger, so I do like what it's done to me. So that's hopeful there. And then Aldana as well. So, and the keeping with the theme of Dry Eye Detectives, here's our Dry Eye team, our squad. And hopefully tonight we'll be able to hear from different members of the Dry Eye squad, detective squad, as we look at different conditions. And I wanted to share a few quotes to kind of start and set this the scene or the context of what we're looking at. I've shown this slide in the past, but I think it's a powerful image of the different causes of dry eye. So they call it dry eye etiologies, different factors that could lead to dryness. And if you look at this wheel, the circle, there's over maybe a dozen different factors, from autoimmune conditions like arthritis, hormone changes, maybe systemic diseases, or treatments for those systemic diseases. Maybe there's a hereditary component. Nerve damage is common among post-eye surgery patients or chronic glaucoma patients. Maybe there's a nutritional component. Certainly environment is a big factor. It's all around us all the time. Different visual demands and habits, eye accessories for makeup, and eye surgery specifically. So these are just a few of the many causes that can come from different settings all around and lead to the dryness. And I think this is one of those factors why many times patients might be doing well, and then maybe all of a sudden their eyes feel extra dry again. There's a flare-up. Something's changed maybe in their environment or their visual demands, for example, or maybe their autoimmune conditions flare up. So I show this to you because it kind of sets a scene of what we're trying to do as detectives, that all eye care providers who treat patients with dry eye disease, DED, must exercise their clinical detective skills. That's a quote from the Dry Eye Workshop 2. It was published a few years ago. And I add the word detective skills because that's what we're really trying to do. And they made this disclaimer: the management of dry eye disease is complicated. And why is it complicated? Because it's a multifactorial condition, multifactorial etiology. And our goal as detectives, and really as patients, is to find the major causative factors. So I think one of the keys of being a dry eye patient is to be a dry eye detective yourself and figure out what in your setting may be helping or maybe hindering, hurting your dry eye disease. And then we try to identify those factors and modify, minimize, and prevent. So we try to find out these major causative factors. In the most recent dry eye workshop, the DEWS 3, this just came out in May, a few months ago. One of the reasons for doing this updated workshop, this consensus series, and these are maybe 150 dry eye specialists from around the world. And they get together, and over several months and even years, they come up with different consensus points on how to diagnose dry eyes, how to treat it, different testing that works. And this is one of the things they came up with was a new definition of what dry eyes is. And I wanted just to pass along the first 7 words of the new definition because it is a good reminder of this condition, of what we're trying to do. And they described it as a new definition, the updated version. Dry eye is a multifactorial, which we already identified, symptomatic disease. So tonight we'll talk about this factor here, this multifactorial component, different drivers, and the symptoms that come from, that are associated with dry eyes. We know that dry eye disease is a vision disease. It can affect our vision stability. It's a lifestyle disease. Many of you patients that looked at the attendees, I know it's can be really challenging and problematic with your dry eyes. It's hard to do the things you like to do sometimes. Reading small print or prolonged reading. Driving can be challenging, being outside. It might be hard to go to one of your grandchildren's games because of the wind or the environment or the allergens. So it causes a lot of different symptoms in a lot of different ways. Dr. Brar and Dr. Ackerman and I were at a dry eye meeting last night, and they talked about how dry eyes even affects the quality of our sleep. So there's definitely a 24-hour effect in our life because of dry eyes. And here's kind of a summary slide of all these different factors done a different way. If you have your phone, you can scan the QR code. This will take you to this area here, this report. But it shows, again, just the different factors that are related to dry eyes. And what we want to start with is, keeping with this theme, is as providers, to try to find the most important factor, the most major significant factor. We ask 2 questions. When do your eyes bother you the most? And what is the main symptom? So hopefully between those 2 questions, between your answer and our testing, we can hopefully find that causative factor and help your eyes feel better. With that said, here are some common symptoms. And kind of looking at it as fingerprints, it is just as each fingerprint is different, each patient's different. And each patient has a different component that could be causing, components that could be causing their dry eyes. And so I thought as a team, we could, as a detective squad, put up 6 main symptoms that patients have that can be associated with dry eye disease or ocular surface disease. And we'll kind of go through here: frequent styes, or morning redness and burning. Maybe my eyes feel tired in the morning and foreign body sensation that feels like there's something in it all the time. And maybe another patient might say they don't really hurt or feel dry, but my vision fluctuates a lot. I have to keep blinking to get clearer. Some patients might say, no, my vision is just blurry. And it's more than just getting new glasses or new contacts. Some patients might say my eyes are always red and they're sensitive to light. So here are 6 key signs or symptoms. And I'll leave it up to Dr. Brar and Dr. Ackerman. Hopefully you're still on there, and maybe Detective Aldana or Detective Leslie. Which one should we start with? Is there one that looks interesting to you that we could click on and investigate further and see if we can find some general features of each of these symptoms that might help our patients? I think hopefully be able to chime in, Dr. Brar and Dr. Ackerman, or Detective Brar, Detective Ackerman today. Frequent styes. Thank you, Dr. Ackerman. So let's talk about styes. That's a common one. and very challenging ones. We'll click on the fingerprint, and here's where it takes us. So this patient talks about, I keep getting these styes, and even more, my eyelids themselves are itchy. And even I have a little bit of matting in the morning time. So we look at these different signs and figure out what can be causing these recurrent styes. Many times the first step among patients with frequent styes or itchy eyelids is let's take a close look at the eyelashes. And within the lashes, they're doing their job. They're keeping debris out of the eyes, but sometimes with this lash debris buildup. And with lash debris buildup, then there's inflammation along the eyelid margin, inflammation within the glands. And when there's gland blockage, then many times they get blocked, but also they get infected. So the first step in treating styes is to make sure everything's cleaned off. When things are clean, they just work better. So one step is we first examine your eyelashes, your eyelids, and making sure that the lashes are clean and clear. This is a common type of blepharitis, or seborrheic or staph blepharitis. It can be a factor in meibomian gland dysfunction, which we'll talk about later on. Another factor that we're learning about is the role of Demodex. And Demodex is a type of mite that we all have. It's a parasite that lives on our skin. There's one type of Demodex that loves our lashes and more importantly, loves the follicles in our eyelids. And that's where they cause three things that happen. These Demodex mites, they cause inflammation of the glands, infection of the glands, and irritation of the glands. And as a result, that leads to styes as well and further gland inflammation. Here's a patient who I was looking at for their eyelids, and they had some loose or low-lying eyelids. I had this patient look down, and you can see this kind of waxy, oily, greasy buildup along the eyelid margin. This is a classic sign of Demodex blepharitis, a type of blepharitis that we're better appreciating as a cause of styes, itchy eyelids, and dry eyes. So this is actually the byproduct of these mites that live up here in their glands, and we get these byproducts down the bottom. These byproducts actually cause a lot of inflammation along the eyelid margin and contribute to styes and gland dysfunction. So we can have just the different types of buildup, and as a result, it causes inflammation, but also you can kind of see this waxy, oily biofilm. Kind of like we might get plaque along our teeth. This is a waxy, oily biofilm along our eyelids. So we want to clean that off as much as we can. And there's different levels of this blepharitis and inflammation, this waxy biofilm. You can imagine and understand how if there's glands underneath this waxy, oily film, then they just may not be working well or they're already clogged. It'd be kind of like having a slow drain in your house. A slow drain is more likely to get clogged. Well, a slow gland or this oily biofilm or blockage is more likely to get clogged. And as a result, it leads to styes. So for some patients, when the first step in treating styes is cleaning the lashes, open up the glands, improving the function. And sometimes it takes not only cleaning, but also topical eye drops. Here's another patient with lash extensions. Demodex loves these lash extensions just because those who have them may not be cleaned well or as frequently, and it builds up, causes this oily film on the bottom. We try to clean off in the clinic, which is helpful, try to open up some of those pores. Sometimes we'll do a special cleaning in the office. This is called microblepharoexfoliation, or MBE. It's basically a soft, gentle, high-speed brush that we use to clean along the eyelashes and eyelids. Similar to how you'd go to the dentist and get a good cleaning. And it cleans it more than just with our home cleaning. This is something we do in the office as well that cleans it more completely. And this is a before picture and an after picture. So what else can we do to treat this Demodex blepharitis specifically, this challenging condition that can be closely related to styes and dry eyes because of gland dysfunction? Well, there's a new medicine out called XDEMVY. And some of you may have already been prescribed this. Those who have and who needed it are getting great results. This is an eye drop that you actually put in your eye. It's used 2 times a day for 6 weeks. And that's 2 full life cycles of the low mites that live within our eyelids. and it clears it off perfectly. I'm amazed. It's really amazing and neat to see when patients come back, their eyelashes look so much healthier, and there's less redness along the glands, along the eyelids, because there's less inflammation, less infection, less irritation that's caused by these common mites there. So it's an eye drop you take 2 times a day for a total of 6 weeks. And the studies show that maybe 50 or 60%, about a year out, are still looking good. They don't need any retreatment. But some patients might need a retreatment, and we're still trying to identify who those patients may be. Any comments from our detective squad? I think you can hopefully make some comments there. Here's a here's a link to a website you can look at that talks more about Demodex blepharitis. And it's an animated version, of course. I think it's maybe not for those who might be a little squeamish as it is, but it's a common condition. We all have it. And importantly, it doesn't have anything to do with our hygiene. It just says, for some reason, in some patients, it overpopulates, maybe due to their skin type or the oil condition. But here's a great link if you wanted to follow along on that one. Yeah, so Dr. Ackerman or Dr. Brar, any comments so far about Demodex blepharitis? And I think I might be able to make it so you can log in too, or if you can speak into it, it would be fine. So this is a good link if you want to learn more about Demodex blepharitis, everything you ever want to know about this condition. Yes, Dr. Brar, please. Let's see if, are you able to speak into the microphone? Sorry, Dr. Brar, I can't hear you, so maybe. Okay. I will keep going, and if there's, I hope that you can hear me. If there's something you want to say, maybe just type it into the text box, and I'll look for that as well. But this is Demodex blepharitis, a common condition of styes or associated with styes. Here's a pre-treatment with XDEMVY. And what I want to show you is look how much less redness there is along the tissue. That means there's less inflammation in the glands. And the Demodex blepharitis, these collarettes, kind of waxy, oily, greasy area, all cleared off. Amazing. And this is sty reduction. This helps not only reduce styes, but also unclogs the glands so they function better. So that brings us back to our first clue. We talked about frequent styes. Any recommendations on the next clue as detectives for patients and for providers on what to look for? Good. Okay, thank you, Detective Ackerman. No pain, just blurry vision. This will be a good one. So we'll jump down to this clue. And like I said, that each patient, just like each fingerprint is different, each patient is different. So this is an interesting patient who said, my doc, my vision isn't, my eyes aren't hurting me. They don't feel dry, but my vision is just really blurry. And you can see, here's a picture of this patient's, their right eye. And you see these little green spots. These are areas of dryness where it's little tiny micro scratches. This would be kind of like if you had dry hands. This is dry eyes. And it's so significant that it's even caused some scarring centrally. Unfortunately, this patient's eyes have been so dry for so long that the nerves have turned off. So the nerves aren't working 100%. Normally, in other words, another way to say that is normally a patient with this much dryness, all these little micro scratches, should be in a lot of discomfort. The eye is so sensitive, a little scratch hurts a lot. Well, this patient has a lot of scratches. But unfortunately, they weren't in any discomfort. It's because the nerves have turned off. It's a concerning condition called neurotrophic keratitis. And it happens if our eyes are too dry for too long. There's some common factors for it. Sometimes it could just be due to uncontrolled diabetes or maybe types of surgeries can do it. Prolonged use of drops, like for glaucoma patients that have preservatives in it, kind of deaden or turn down the nerves. It'd be kind of like having a diabetic patient who has a diabetic foot ulcer. They have an injury there, but they just can't feel that it's injured, so the body doesn't know to heal itself. Well, the patient came in and he said, I'll give you 4 chances to get this healed up. He was on not very excited to be there, but his doctor was right on to identify, saying, you need to get this checked out, otherwise it'll cause more scarring. So he said, I'll give you 4 chances. The history was important because this person had a retinal detachment and laser surgery to help heal it and repair it. But by so doing, it affected the nerves in the back part of the eye that affect the nerves in the front part of the eye. So as a result, we have this diffuse dryness, little scratches. And it's important, one of our first steps as providers is to do corneal sensitivity testing. And one way to do that is by using a cotton wisp or a cotton Q-tip. And we kind of tease out the end and we gently touch it to the front part of your eye. By doing that, we're checking your blink reflex. Normally, if it touches the eye, it should blink really easily and really quickly. If not, if we can touch the eye and even touch it and push it in further, that tells us that those nerves, unfortunately, aren't working 100%. So in some ways, it's good when we put a drop in a patient's eye and they say it's burning. That's good. That means the nerves are there because it's the nerves are in good function. But sometimes it's concerning if we touch the eye with this or we put a drop in and the patient feels like it's not burning, that means there might be a neurotrophic component possibly in severe cases. There's a really good video. If you scan this QR code, it talks about NO-NK. So KNOW-NK. NK stands for neurotrophic keratitis. So this is a good opportunity to learn more about neurotrophic keratitis, what this patient has. So here's what we did. We found out that this patient has neurotrophic keratitis. The cornea isn't working as well because the nerves aren't working as well. So our first step is to get the nerves turned on again. And we prescribed a treatment called Oxervate. This is a nerve growth factor treatment. So it turns the nerves back on, helps the nerves work better again. We prescribed Oxervate. We did, I believe, 2 amniotic membranes. And by the 4th time, we got him. Looks like he was improving and the surface is much more smooth. Unfortunately, vision still reduced because of a central scar, but nicely healed surface because of this combined treatment. Oxervate is a eye drop that the patient takes 6 times a day for 8 weeks. It's a nerve growth factor, and it helps the nerves turn back on. Combined with special amniotic membranes that have also growth factors, it helps it heal up and keeps it healed. So through checking corneal sensitivity and using some new medication like Oxervate, we'll help get it healed. And I do see a hand raised, so this is a good chance to maybe come back there. Let's see. Yeah, so if you have any questions, feel free to put it in the chat there or in the Q&A section. Good. Okay. So this talks about neurotrophic keratitis. It wasn't any pain, but his vision was blurry. And this is one of our first steps as a provider to check your corneal sensitivity. Here's Procera. This is that membrane that helps it heal. This is before and after. Usually leave this membrane on for 3 to 5 days, depending on the type of membrane. There's a new type of membrane. Normally we use this soft membrane, or this membrane held in place by a soft plastic ring. There's a new one out that's something we just put in a contact lens, so this is much more patient-friendly. It's basically like Procera, the amniotic membrane donated from a healthy pregnancy that's been cryopreserved and placed into a sterile unit so we can put it on the eye. Many times this membrane has been used for burn victims. Now we're able to use it for the eye to help with healing. This is a great way to help patients with significant dryness to get healed quicker. Here's an example before and up to 48 hours. So if we find to use that, we have a lot of good options for this cryopreserved amniotic membrane. Sometimes we could just use a contact lens even and that helps with healing. Here's diffuse dryness. We did a contact lens a week later, looked better. Sometimes there's so much dryness we need to do this special healing lens, the amniotic membrane. And this is what it was about 5 days later. So there's fortunately some really great ways that we can help the surface heal when it's been so dry for so long. And I'm just checking a thing here. I'm going to see if I can, looks like Dr. Breyer's texted me saying the chat is disabled. Let me see if I can make sure we can do this. Okay, chat is on for everyone. I'm so sorry about that. So if you wanted to open up ask some questions there. Yes, and then let me go back and see if I can show this. Mr. Himsel, thank you for asking a question. Can you scroll up on the screen a bit? 1/4 of the picture too low to see. Yeah, let me see if I can go back to show you what we're looking at. I'm not sure if I can scroll up any further, unfortunately. This recording will be saved online, and I might be able to send you, I could just send you the handout too if you'd like for me to do that, Mr. Himsel, just let me know. But it does show the dryness there. Good. So this is an example of neurotrophic keratitis and the value of using the right medicine to turn the nerves back on, as well as special amniotic membranes to help with healing. Good. Okay. And I still find the chat is disabled. Let me see if I can turn this on here. Okay. Hopefully I've turned that on so you can chat with those you need to. Great. So let's bring this back to our home screen then of these different factors for dries. Any other ones that look interesting to you? We'll see the chat screen's working for you now. Yes, Aldana. Detective Vaughn, where would you like to go? Let's see if I can see this here. And then, yep, so let's go to the next one here. This is a common one where, oh, good, the chat's on. Morning redness. Thank you. All right, good. I think we got it. Sorry for the technical difficulties there as well. Thank you, Detective Vaughn. So morning redness and burning. I think the key here for morning redness is our eyes should feel the best and look the best first thing in the morning. But if in the morning time our eyes are dry and burning or red, there's a concern that maybe there's some nighttime exposure. So let's click on this clue and see what factors may be involved here. So this person has morning redness. You remember from one of our earlier slides, we talked about this dry pattern. These like little micro scratches or abrasions on the cornea. But look at this pattern, it's unique. And then up here it looks really good. And then down here is really dry. So what do you think could cause something like that in a setting like this? And if you look at the eye, with this part being good, this is a classic example of an exposure keratitis, where this patient's eyelid didn't close all the way. It closed right about there, and this part of the eye just dried out. So here's for both cases for that. So one way to test for that is, one of our first steps is we do this little flashlight test. So we'd have you tilt your head back, close your eyes like you're sleeping. You don't have to squeeze them tight, but just close your eyes like you're sleeping. We put this flashlight on your eyelid, and what we'll do is we're looking for any light sneaking through. And we kind of grade it on 1 to 4, depending on how much light is sneaking through. If there's a little light, it's maybe trace. If there's a lot, maybe grade 3 or grade 4. But that tells us that maybe there's what we call an incomplete lid seal or inadequate lid seal. And inadequate lid seal means that at some point while you're sleeping, So your eyes being closed, they're open up some. And if they open up some, they dry out some. As a result, then when you wake up, your eyes feel dry or scratchy or burning. And it has this appearance like this. And we've found that patients who may not close their eyes all the way during the nighttime may not blink all the way during the daytime. And this is an example of a patient with an incomplete or partial blink. So they blink really well down to there, but not all the way all the time. So as a result, this area here gets really dry. Related to this, patients will often say that, yeah, my eyes feel dry in the morning time, and then I'll put some drops in, they feel better, they'll blink, and then as the day goes on, then my eyes feel dry again. The reason for that is it starts off dry, they use some artificial tears during the daytime, and then because they're a partial blinker, their eyes feel more dry as the day goes on because of this exposure. So we found that blinking exercises helps a lot for these patients, making sure they blinking exercises just mean being mindful you're blinking. It's kind of like breathing. We don't think about it, but making sure we blink regularly and completely for that complete closure. So taking breaks throughout the daytime. We learned last night in our dry lecture that an average person spends at least 7 hours a day on the computer, and computer work or reading won't hurt our eyes. But if we're really focusing, many times we're not blinking as much or not all the way. And then as a result, it dries out slowly as the day goes on. So one of the first steps for this, if someone says their eyes feel dry as the day goes on, or dry first thing in the morning, is protecting it. How would we protect this at nighttime? So it looks better in the morning time, would protect it at nighttime. So something to do before you go to bed is maybe an artificial tear gel or an ointment, something thicker than a tear, and that helps coat the surface so it acts like a liquid barrier. So if your eyes do open up, you have this liquid barrier there to protect it. Another idea, sleep mask, something to keep the eyes closed, or some people do both. None of it's perfect, but if we can protect it more at nighttime, ideally it starts the day off better during the daytime. And then during the daytime, making sure you take breaks when on the computer or reading, make sure you blink regularly, completely. Helps with that part too. So blinking, there's an exposure component for it. Interestingly, generally dry eyes might be due to low tear quantity or low tear quality, but another reason for it could just be due to exposure. This patient has good quantity tears, good quality tears, but in between blinks, they're just not blinking all the way and they still feel dry. So you can be doing a lot of great things with all your dry treatment, but if they still feel dry, consider an exposure component to that. Great question. The question was, can a car air conditioning unit, the AC, cause the eyes to dry out and during a time when the eyes may be open more and wider due to driving? Great example. Yep. You're already a detective, Mr. Himsel. When you're driving, you're trying to figure out, well, what's making this worse? And when you're driving, we're really focusing like computer work or reading. We may not be blinking as much. As a result, they dry out more. And then add to that any forced air. So whether you're driving, as you're really focusing, that's making it dry. Or maybe if you're outside going for a walk and the wind's blowing on your eyes, that can dry them up more. So that's a good time to wear sunglasses when you're outside, or with almost like a protective seal around them. So if you can find what's causing the dryness as a detective, like you already are, find ways to prevent that. So for the car AC, either redirect the AC so it's more towards your feet, or turning down the air conditioning. Anything we do to control the airflow, the air humidity, the air quality. Those are big factors. Yep, great question. Thank you, Detective Himsel, for that. I appreciate it. And this is from another AI image from Detective Leslie. Basically, what we're saying is we need that full eyelid closure. We need it for the maintenance of the surface. If we don't get that full eyelid closure, the surface isn't as healthy. We're risk of evaporation of the tear film and dryness. So making sure you take time to blink regularly and completely and rest your eyes. Thank you, Detective Gruber, for that good visual and good reminder. Good, so we talked about styes, morning redness, talked about no pain, just blurry vision. Let's go into this one, tired in the evening and a foreign body sensation. This kind of goes along with this. So we talked about how sometimes our eyes might feel dry or tired as the day goes on. Well, how about in the evening time? and this is maybe more common among computer users, it's kind of an extension of what we just discussed to consider our environment. So we mentioned that the average person spends more than about 7 hours or more on the computer, and there's some things we can do that might help that. Some common tips that are effective: making sure you have glasses that are for the proper distance, take regular blink breaks, take breaks overall. Ergonomic, making sure the screen is just a few inches lower than the center of your vision. If the screen's up here, then we're going to be looking up all the time, less likely to blink as naturally as if it's down just a little bit lower. So making sure the computer screen is down just a little bit so you're having more likely to have a regular blink and a complete blink. Increase the screen size and the font. Maybe there's less strain in that way. And then be mindful of your environment. Watch the airflow in your office setting, the air quality. Maybe you need an air purifier and an air humidifier, depending on where it's at. And then just try to limit your screen time if you can. Take breaks, making sure you eat healthy, stay hydrated, going for walks. Part of that is omega-3 supplementation and nutritional side of it. So these are ones that are likely effective and effective for patients who have this tired eyes towards the end of the day. It's all about the environment, taking breaks. Other things that go along with that, we talked about using a humidifier at home or in your office setting. There are some small portable ones, which one of our patients told us about. She's a sales rep and she travels a lot. So this goes back to your question about the car AC. And in the wintertime, it's so challenging because the heater's on, making her eyes, the air quality in her car really dry. So she found online you can just get a portable humidifier, you just put in your car cup holder, and it creates this nice humid environment in your car. So that way it's not so dry. She was a great detective. She figured out when it's bothering her and what she can do to minimize that. Here's another idea. There's some glasses online you can get that have a nice wraparound. So if you're outside walking or cycling and patients say dry out the most, get something like this with a nice wraparound and almost a foam seal in the center. That way it protects your eyes from an exposure, but also allergens or pollutants, things that could cause the eyes to get more dry. Here's just another example from the DEWS workshop there. It just shows how the environment is always around us, all these different challenges, from indoor air quality, airflow, outdoor allergens, pollutants, and then you add to it high elevation, smoky conditions, cold air. All these different factors are all around us that can affect the ocular surface. And that's what makes it so challenging. So as our eyes are tired towards the end of the day, trying to figure out what can we do in our environment that's always around us that we might be able to minimize and prevent these factors. You detectives are doing great. I appreciate the ideas and the questions. And then another question that just came out, what is your opinion on taking eye vitamins like Ocuvite? I talked about how there's supplements for dry eyes. The question is about Ocuvite, which is a good medicine for macular degeneration. These are great supplements. Several key studies have found that certain antioxidants can help reduce or slow down the risk of macular degeneration. Ocuvite's a good one for that. And I also feel like the best way to get the nutrients we need is through a healthy diet. So making sure you eat healthy, that's fruits and grains, nuts and vegetables, and maybe ocean fish a couple of times a week. Those are the best way to get the nutrients we need. But there are some really good nutritional supplements out there for macular degeneration, or in this case for dry eyes. A new one that's come out, and you can write this down, is called Blink NutriTears. Blink NutriTears. And it's a pill you take once a day. It's available over the counter. And it has 4 ingredients in it: vitamin D and curcumin that helps with inflammation, and a few antioxidants. It's a pill that's once a day, so I like it as far as adherence. And we're getting good results with that as far as nutritional support or supplementation. I like it. That great question, Ms. Miller, that now we have a chance to add nutritional support into this chronic disease. And I feel like there's a connection with that. So appreciate you asking that question as well. Well, we just have 2 more fingerprints to go over and go from there, but I really appreciate the questions so far. How about we'll go to the fluctuating vision, then we'll finish with sensitive light. This is a common symptom among patients. Many times patients will say that my eyes don't feel dry, but my vision keeps fluctuating. And sometimes it's difficult to understand how our dry eyes can affect our vision. But simply put, our tear stability affects our vision stability. Our tears play a major role in how well light focuses in our eyes. So here's a video. I want you to look at this tear film. First of all, you can see these little dry spots that we've talked about before. But look for dark spots that show up. So this is where a setting where I ask the patient to take a blink and then hold it wide open, try not to blink. And can you see what's happening here? These little dark spots showing up. Those are areas where the tears are breaking up. It's what we call our tear breakup time, or a condition common in evaporative dry eye. So either the patient needs to blink every 2 seconds to keep the tears we want, or we need to prolong that tear breakup time. Normally our tear breakup time should be closer to 8 to 10 seconds or more. This patient was maybe 3 to 4 seconds. So this can be really challenging for their vision, not for how they feel, but also how well they see. And the key principle here that we found for the most recent dry eye workshop is that an unstable tear film is a central feature of dry eyes. Meaning if we can stabilize the tears, then that's going to help stabilize a lot of the symptoms. And sometimes patients with evaporative dry eye won't have all this dry eye damage, but they'll just have the fluctuating vision. So they'll have symptoms of dryness, and many times if it feels like it's drying out, but more likely it might just be the fluctuating vision. And that's what it kind of shows. I'll just kind of briefly go through this from this workshop. It talks about dry eyes as a multifactorial disease, a vision-affected disease, socio-medical disease. And basically we're looking at this unstable tear film cause all these factors. Here's right after they blink. Here's about 3 or 4 seconds later. So that unstable tear film can cause unstable vision. And this comes from the glands. If the glands aren't able to squeeze out the oils like they could or like they should, if they're more blocked and come out like toothpaste, then it's not going to be able to stabilize the tears, and the tears will evaporate quicker than they should. It creates what we call evaporative dry eye. So either they're just really thick, not come out, or they're just really blocked, not coming out at all. And sometimes in the office, we might just try to express it. Use a Q-tip, for example, and express the oils so we can get the oils to come out. This is almost like toothpaste that's coming out so thick. And it keeps coming out. But if we can improve the oil quality, it's more likely to come out easier. Here's an example where one's just blocked and clogged. If I pull down the lid, you can kind of see it almost looks like a tooth. Well, we open up this pore and we're able to squeeze it out. So we'll get some gland function again. This is really what causes styes. As we mentioned earlier, blocked gland gets clogged and then gets infected. Here's an example of a blocked gland all the way down here. And on our meibography, that's what it shows there. It's always producing oil, so it just kind of fills that area and fans outward. So as part of this course, as part of our care as providers, we want to make sure that everyone has this meibography. It's a really great way to look at the glands. And as a thank you for your time, we wanted to offer a complimentary meibography to you. Anytime you're in the clinic, next time you're in the clinic, just let us know. You can use the word gland scan. We'll know what you mean. Or just let them know you attended our webinar. And we're happy to do this meibography for you. Meibography is a way we can look at glands. So let me show you some examples of this. Meibography is kind of like an x-ray of the glands. And this is a great example of what normal should look like. It should look like piano keys. There's 25 to 30 glands along our eyelids. Sometimes, though, through time, they might get blocked or stretched. You see those areas there. Or some are missing, especially in styes. And sometimes they get shorter. You start missing more and more. And sometimes they're just little spots of glands where unfortunately it's scarred down so much, or we've lost them so much, where they just don't have a lot of glands that are working. Unfortunately, we can't get those glands back, but we can do is have the glands that you do have work better. Some ways we can do that at home is through a heat mask. So one common one is the Brüder mask. Basically, it's a reusable mask you put in the microwave, heats it up, and it provides heat on the eyelids longer than a washcloth would. So these are reusable. We want that heat for about 7 to 10 minutes. Ideally, for 7 to 10 minutes, it's enough to heat up the glands, to heat up the oil so they start coming out better. Or another option is there's some travel ones you can get. You just plug them in. This is great for traveling, that we can keep up with your routine, especially if you're in an area where they might not have a microwave. You can try something like this as but with your routine and keep the glands working well. Another idea is through some in-office therapy. So sometimes patients are doing home therapy with a heat mask. They're blinking regularly. They're keeping their lashes clean, but still not getting to the point where they need to do it. The next step is a good investment like this, where we use light therapy. And this is called intense pulse light therapy. We do a series of intense light bursts along the side to target these glands that are blocked, decrease inflammation. And then we use a healing red light therapy that heats up the glands, heats up the oils so they start coming out better. Great. So these are some in-office therapies we can do as we found helpful. And let me give you some examples of this. Here's a patient with some oils coming out, but see how cloudy it is? Almost like melted butter rather than like olive oil. And this is just more kind of toothpaste-ish and a lot of inflammation. Here's went through the intense pulse light therapy and low-level light therapy series, and much better clear oils. And Carl hardly see, they're so clear right there, and much better expression, less inflammation. We found that when there's less inflammation, things work better. When things are clean, things work better. And that's what we're trying to do for the eyelids to improve the gland quality. Here's another example of a patient with a lot of inflammation along the eyelids, not much oil expression. And after 4 sessions of intense pulse light therapy and low-level light therapy, much better expression, less inflammation. It'd be kind of like having an inflamed elbow, just doesn't work as well, but on the eye, on a microscopic cellular level or gland level, it doesn't work as well when it's inflamed. So taking away that inflammation helps it work better. And this means more stable vision, more comfortable vision. Here's another patient with not many glands, but if we can activate those glands, get them working better again, we'll be able to improve their surface. So there's great benefits, nice technology, things we didn't have handled readily several years ago, but now we have some good options for it. Good. So we're going to talk about, looks like a few more questions here. The name of the microwavable eye patch, the one I showed you is called Brooder. We don't have any financial interest in any of these, but a Brooder mask is something you could try. You can look online for microwavable heat masks or plug-in heat masks, and there's several good options out there. All of them work really well. Some might be more comfortable than others, but we just want something that stays warmer longer than a washcloth, rather than warming up then cooling down after a few seconds. We want that sustained heat. And you also asked a great question. His eyes water continuously with tears running down your face quite often. What causes this? So as I said earlier, part of being a dry patient is being a dry detective. You're already trying to figure out, well, what's happening and what's causing symptoms. This sounds like, and this is sometimes not a common sense response, but sometimes when our eyes are dry, then our eyes water. Meaning as a reflex, the eyes think there's something in it or it's dry, so it's watering. However, those watery tears really don't treat the underlying dryness, so it never really treats the underlying problem. But sometimes if it's just watering every now and then, specifically like with prolonged computer work or reading, watching TV, that's probably more dry eye related. However, if your eyes are watering all the time, we need to take a look at the tear ducts. There's a chance that the tear ducts themselves are blocked. A blocked tear duct backs everything up. So it's more of a plumbing problem that they water, and if they water continuously. So it could just be the dry eyes if it's more intermittent, but if it's constant, we'd be concerned about a tear duct blockage. We'd want to do some tear duct irrigation. Yeah, great question. So at the end of this session, in fact, I'm going to go ahead and do it right now. For low-level light therapy, we did want to give away 3 low-level light therapy sessions. So the value is $150. We feel like it's that important just to offer this for the patients, for those who have gland blockage. Takes about 20 minutes. We do it here in the office. So it's very convenient for the patient. Doesn't hurt. You get up and go. There's no restrictions. So this is something we could do to help with your dryness as well. So for the ones, it's a random call in for the one random patients. One is Stacy Diedrich. So Stacy will record you down. And Aldana or Dr. Brar, can you kind of keep track of these names so that we can add that to their file as well? So thank you, Stacy, for joining in as well. Then another random one is Sue Arnold. Thank you, Sue, for joining in tonight as well. And the final one is Ty Finishel. Ty, thanks for joining in as well. This is great to have you. So it'll be Ty Finishel. I'm sorry if I keep mispronouncing your last name. Sue Arnold and Stacy Diedrich. So thank you all for joining in for that, for the low-level light therapy session. Congratulations. We look forward to working with you in the clinic so we can add that treatment to your well. Good. Okay. So I have another question here. Cheryl, thank you for bringing that in. I'm going to answer your question about Tyrvaya here in just a moment, because that's an important part of it. I'm glad you brought that up. As we talk one more about in-office therapy, another thing you can do at home is a new eye drop called MIEBO. And this is a really great way to help improve the tears. It's a tear stabilizer. So it helps treat meibomian gland dysfunction. And if we can treat meibomian gland dysfunction, get them functioning better, we have better tear stability. But as a supplement to that, MIEBO helps stabilize the tears, acts like a tear stabilizer to minimize that evaporation. It makes that tear breakup time longer. And here's a link to that if you want to take a QR picture of that. But if you look up MIEBO, it's an eye drop you take up to 4 times a day. It's preservative free, and there's no steroids in it. So it's a safe medicine to take. Here's an example of a tear breakup time. This one's from Dr. Brar. This one's from me. You can see how the the staining pattern was such. This dry eye was really happy with what it's doing. So we got to treat that dry eye, get that dry out of there. And this dry eye was sad because this patient's vision seems to be fluctuating a lot due to tear film instability. We feel like evaporative dry eyes is a big cause for both of these expressions here. Good. All right, let me see what other options there are for other questions for that. And we just have one more to go. I want to talk about Tyrvaya. This kind of goes along with this one as well. Let's see what other questions we have for this part. Yep, so I think we have a list of the names. It's Sue Arnold, Stacy Diedrich, and I forgot the third one as well. We have it written down, and we'll make sure you're contacted you. So, okay. So the final one here is, let's go to this. Good. Red eyes and sensitive to light. So finishing up our webinar tonight on dry eyes. Is red eyes and sensitive to light. And this is a common sign related to dry eyes, and it's a sign of inflammation. So either inflammation is causing the dry eyes, or dry eyes is causing the inflammation, or a combination of both. Either way, we have to make sure we stop the inflammation. And one way of doing that is through improving tear quality and tear quantity. One way of that, as one of our attendees asked, is through a medicine called Tyrvaya. Tyrvaya is what we call a neurostimulator. And that means it helps stimulate the nerves to produce more tears. We talked about earlier about how if there's nerve damage, then the nerves aren't functioning enough to keep the healthy tear film and repair the surface. So Tyrvaya helps stimulate the nerves to produce more of the healthy tears. It's a medicine you take 2 times a day. You shoot it into your nose, not up your nose. But it stimulates the trigeminal nerve here to tell your brain to tell the nerves here to produce more tears. It's a medicine you take 2 times a day through the nose. And for some patients, it works really well. It kind of depends on their type of dry eyes that would determine the response. I mean, if it's just more evaporative dry eye or more due to gland blockage, maybe treating that might be the good first step rather than trying to improve the nerve function if the other areas are blocked, for example. And like we mentioned earlier, as detectives, we're trying to find the main cause, and from that, go from there to treat the dryness. So TRI can be a great option for the right patient at the right time. Related to that, so another way is we want to decrease inflammation. And one way of doing that is just cleaning everything out. So if there's debris in the tear film or underneath the eyelids, it's just stuck there. Unfortunately, that causes inflammation, redness.
Skin does not produce enough tears.
Here's something we just started doing in our office, which is a safe, gentle treatment in the office that cleans out the whole tear film.
Pollutants and allergens onto your eyeball.
Rinsada is a single-use irrigating eyelid retractor. It works by using a gentle pressure wash underneath your eyelids and in the deep recess called the fornix, where normal rinsing cannot reach. The treatment is quick and even refreshing.
We frequently use Rinsada in combination with our other treatments, and patients often feel results before they even leave our office.
Yeah, so that kind of shows a little animated video of what Rinsada does. So if we have chronic redness, let's clear out the whole tear film. And that's when we can do it in the office. Takes about 10 minutes, really gentle effect. And this might be good for patients who have chronic redness, chronic allergies, low tear lake, and the tears themselves can't wash them out. Kind of gives them natural boost for it. Another way we could do that is by using a new medicine called Vivai, or I'm sorry, this one is a steroid. Here's a inflammation, redness, and see all these dry spots. We put them on a steroid, and 2 weeks later, looks like this. So these dry spots are kind of microabrasions, but it's basically areas of inflammation. And when we can control those areas of inflammation, then the surface looks better and feels better. So one of the first steps we might do for you for your dryness and your redness is to use a steroid eye drop safely and for a short period of time. Another one is we can use a medicine called Vivai. This is a newer medicine. Steroids sure work great, but for some patients, we can't have them on steroids too much or for too long. And because there's a chance of higher eye pressure or cataract growth. So there's other medicines out there that aren't steroids, but are immunomodulators. I mean, they decrease the immune system that's causing this prolonged inflammation. So one of them is called Vivai. And we're getting great results with this. This is from Detective Brar, also known as Dr. Brar, but Detective Brar, baseline pictures for Dr. Brar. And then I think it's about 3 or 4 weeks later, wasn't it, Dr. Brar, where after Vivai 2 times a day, much less staining, much less inflammation, and the patient was feeling a lot better. So for a medicine that isn't a steroid, to have this big of effect is pretty amazing. So steroids definitely have a place in dry eye care. As I mentioned, we have inflammation. Either way, we have to treat that inflammation, either it's a cause or result of the dryness. We need to use a steroid, and at least initially for some patients, and then switch to something like Vivai as an option. Some patients might be on Xiidra or Cequa or Restasis. Those are all great medications. This is just a new one that's out there. And there's a couple more that's coming out. One is a Cultramon, and this is called Tripteer. It's been approved. It's a kind of like Tyrvaya. So to our attendee who asked that earlier, this is kind of like Tyrvaya. Instead of doing a nasal spray, it's a drop. And it takes advantage of the nerve sensory pattern on the surface to tell the eyes to produce tears. It's kind of like when you go outside and your eyes water, or when you're cutting an onion, your eyes water. This is the same idea. This is an eye drop that takes advantage of those thermal receptors to tell the eyes to water, not necessarily watery tears, but more of the natural tears. And this has been improved. Hopefully in the next few months, we'll be able to have that as a sample at least, or as a prescription for you. Another one is called, it's a RASP inhibitor. So basically when there's inflammation from these reactive aldehyde species, they create more inflammation. Well, we need to inhibit that through what's called a RASP inhibitor, and it's Reproxalap. I think towards the end of the year, this will become available for us as well to reduce inflammation. So there's a lot of great ways we can help reduce inflammation, help you guys feel better, help them look better, using steroids initially if we need to, or for pulse dosing, but also for patients who can't tolerate steroids, there's a lot of good immunomodulators, like we mentioned. And let me see, I think I saw some pictures coming up. And then we're just going to wrap up here with a few things. Let's see what pictures we have here or questions. Yep, okay. Thank you, Dr. Barr, for that. Great question from Ms. Miller. Should diabetics do anything special for their eyes? That's a great question. And you may remember one of those slides we talked about neurotrophic keratitis. I think one of the top causes of neurotrophic keratitis, where the nerves just aren't working as well as they could be or should be, is diabetes. Meaning, if a patient has high blood sugar levels, high insulin or low insulin, high A1C, those are factors that can cause, unfortunately, nerve damage, not only to like the feet, like with diabetic ulcers, but to the eyes. So for diabetes, one of the best things to do for that is to control your blood sugar levels. And that helps not only the body, but also helps the eyes. And I do have one patient I'm thinking of right now who, after they got better control of their diabetes, a lot of the dryness healed up and her neurotrophic keratitis improved as well. So connected, isn't it? So making sure if we can control our blood sugar, our helps with the eyes, eating healthy, less processed foods, the gut health is important. All these different things that we're finding are connected can make a difference. So staying well hydrated, for example. Well, as we finish up, just want to talk about some dry eye pearls. We mentioned that it can be challenging both as a provider and as a patient to establish this diagnosis, because sometimes the signs that we see don't always match with the symptoms you have. So that's challenging. That thing is, what we try to do is we try to find what's the main factor. We said we must exercise our detective skills to find out the main factor for the dryness. And what we do as providers is we try to have a system. We look at your eyelashes, see how the eyelashes look. When things are clean, they just work better. We look at the eyelid closure. We look at the eyelids, either through meibography, like we talked about, which each of you are entitled to a complementary gland scan or meibography, or expressions of the glands. Sensitivity, because that's important. How are the nerves working? We look at the tear quantity, we look at the tear quality, and we look at the staining pattern. The staining pattern or the dryness pattern can show us what we should target or focus our care on. And then we look at the tear quality. How quickly do the tears break up? What's the tear breakup time and the pattern? And we look for masqueraders, things that could maybe have dry-like symptoms, but aren't necessarily dry eyes due to other inflammation. And then in the dry eye clinic, we try to give you your own plan. We develop based on your symptoms and your signs, where you're starting, where you're at, and where you're trying to go. We give you some treatments for dry eye management, personalized care. So I wanted to take some questions now. I really appreciate each of you joining in tonight. Again, I apologize about the delayed start, but I'm glad you came back on. Let's talk about some questions you might have. We talked about diabetes, controlling that for the eyes. If you're pre-diabetes, I think same idea, trying to eat healthy, watch your blood sugar levels. It helps the body and the eyes. Another great question, a patient talked about eye plugs, and I guess I didn't talk much about that. Mr. Newman, I like how you're thinking that for patients who have low tear quantity, plugs can be a really great treatment for them. So generally speaking, we might have dry eyes due to low tear quantity or low tear quality. Some have both. For some patients, we have to do a plug in the tear ducts to help keep their good tears on their eyes longer. So we have 2 tear ducts on the bottom, 2 on the top. Well, we can use a plug to put in the bottom 2 initially to begin with, and that plug helps keep the good tears on the eyes longer. And we need our natural tears. Our natural tears are better than artificial tears. It's a procedure we do in the office, just takes a few seconds. There's a new version now that I'm finding really helpful. It's called FormFit. The patient can't see it or feel it. It's just a little gel plug that when it gets in the tear duct, it swells up. So it's considered permanent and it doesn't blink out on its own. But we can always rinse it out in the office if we need to, irrigate it out. But plugs can be a great treatment tool, Mr. Newman, for the right patient at the right time. We generally like to control the inflammation first before we go to that route. And then another symptom, I love it how you guys are coming with these different symptoms, things you're aware of. Times your eyes feel like they have dirt in them, and they burn. Try to figure out when that's happening. So my first thought would be, is it first thing in the morning, or is it after towards the end of a long day on the computer, or is it when you've been outside in the wind? And then try to think about what's around that area that you can adjust and prevent and minimize or complement or add to. And hopefully by doing that, give you some more ideas of how you can treat those symptoms that you have there. The challenge with dry eyes is it's chronic. And you remember we talked about the new definition? Dry eyes is multifactorial symptomatic disease. So there's multiple factors that we're trying to identify in different areas at different times that could be causing the dryness. And it's symptomatic. It definitely affects the vision, affects how our eyes feel and how well we see. So yeah, I think in terms of my thought for you would be try to figure out when it's most noticeable and what's going on in that setting, and see if there's a way you can modify or minimize those symptoms. The eye is so sensitive, so it can tell us when it's being bothered, and if we can identify those times, that's helpful. Great. Another question was about probiotics, and I'm glad you mentioned that. You may remember one of our first slides. In fact, I'm going to jump up there. We talked about nutritional health, eating healthy, less processed foods, and there we go. So here's a question about probiotics. One link that is interesting is gut dysbiosis. So if there's low gut biodiversity and poor gut health, may be common in patients who have low gastric motility. They have frequent or infrequent bowel movements. There's less gastric motility. They may have poor gut health. This could come from maybe a poor diet or imbalanced diet. We're finding that can create a leaky gut syndrome. Leaky gut syndrome can link to the eyes and cause inflammation in the body and in the eyes. So a great question about probiotics. Eating healthy is a big factor in that, and the gut can be the basis or the foundation for that treatment. So probiotics are good. Again, as I mentioned earlier, having good balanced diet is helpful. So maybe yogurt or kimchi, sauerkraut, I mean some kombucha, different drinks like that might have probiotics are helpful as well. Pickles, those are good things to eat. Something that has that gut health or probiotics that might be helpful for our gut. And maybe you don't have to have a restricted diet, but maybe cut back on some different meats or harder things to digest, add more grains and fibers, things that are good for the body that help increase that gastric motility and increase bowel movements. We could talk about bowel movements more and more if you'd like, but I've heard some dry experts talk about when they talk to patients about dry eyes, they ask, one of the first things they ask about is how frequently do you have a bowel movement? And if it's not very frequent, that could be a concern that maybe there's low gastric motility, maybe some gut inflammation. So encourage some good gut health through proper diet, again, less processed foods. So yep, great question about probiotics. Good, I think we're kind of nearing the end here. I think I got a lot of the questions answered. Any comments from our dry detectives? I really appreciate each of you joining in as well. What about eye plugs? Yep, and then Thomas, great question about your eyes feeling dry, gritty, and burning, but also you get a film over your eyes, and it's difficult to clear up. Sometimes you have to blink several times. This goes to what we're better appreciating about our tear quality, that if our tears are unstable or our vision is unstable, they might be more watery, as Jim, so rather than oily. And as a result, they're just not being stable for you. So I think you're right. If there's some ways we can improve your tear quality and tear quantity, as Jim, so you'll feel better and hopefully see better, have more stable vision. So I appreciate you asking about that. Dry eyes can be so challenging, but also can be very rewarding if we can improve and meet these different factors. If we can identify the factors and improve them, then patients many times feel better. It's not an overnight fix and it never goes away. It's a chronic disease, kind of like arthritis is for autoimmune conditions. But if we can make it get to the point where it's sustainable, the symptoms are less frequent, less severe, that's our goal. Okay. I think we're finishing up. Any other questions or comments? Again, I appreciate you joining in. I'm just embarrassed that we started late. I left the office today a little bit early so I could get home for the lecture. And I had the feeling, I think I'm forgetting something. I thought, no, I think I have everything I need. And then I went home, and as I was getting ready to get on the computer, I realized I didn't have my thumb drive. So made a quick dash in here. I'm sorry for the delay, but hopefully it's been worth your time and helpful for what you've learned tonight. And as a detective squad, your dry team providers, we're trying to learn together. So we appreciate everything you teach us, and as we learn together in this important condition. Thank you so much for joining in tonight. This will be recorded. This is being recorded. This will be online on our website. You can view it later on. If you have any questions, or if you're interested in the handout version, I'd be happy to email that to you. Just send me an email at austin@caringforeyes.com. Thank you so much for coming in today, or virtually, and have a great night.